When you're a teen on your way to becoming a young adult, there are new milestones around every corner, like gaining more financial independence, moving out, and gynecological exams. The Lowdown on GYN Exams. Hi, I'm Maddie. If you were assigned female at birth, then the American Congress of Obstetricians and Gynecologists recommends that you have your first gynecological exam between the ages of 13 and 15 years old. Don't worry if you haven't gone yet, but it's important to be proactive and visit the gynecologist now. But it's important to get the lowdown on why this is an essential part of maintaining your sexual health, whether you're sexually active or not. Gynecologist visits are an essential form of preventative healthcare. These appointments can include breast exams, pelvic exams, both external and sometimes internal, and PAP and HPV tests when you're older. These visits can help answer any questions you might have about breast or pelvic pain, unusual bleeding or menstruation, as well as addressing any questions related to reproductive health, pregnancy, fertility, menstruation, or contraception. But you can also ask your doctor about relationships, sex, sexual identity or orientation, and sexually transmitted infections, or STIs. Lots of people are hesitant to visit the gynecologist because of anxiety or misinformation. I know the thought of someone observing your genitalia can be embarrassing or awkward, but honestly, it's just like any other checkup. You should take some time to make sure you're comfortable with your doctor. Some people prefer to have another person in the room during exams, and others have a racial or gender preference for their doctor. Above all, you should look for someone you can be candid with. If your doctor makes you feel ashamed or embarrassed in any way, it's time to look for another one. You can go to your campus health center or a local health clinic like Planned Parenthood. And you can find these clinics using our clinic finder on our sister website, sexetc.org. You can expect to fill out some forms so your doctor gets a full picture of your medical history. They may ask about sexual partners, oral, anal, and vaginal sex, and family disease history. It's important to be as honest as possible. Your doctors are there to help. For the exam, you'll lie down on your back, scooting down on the table, and then putting your feet into something called stirrups. Your doctor will then perform an external visual exam looking at your vulva. Then they may also perform a breast exam. They may conduct a pelvic exam using their fingers and potentially a tool called a speculum, and you might feel some pressure during this. Often your doctor will give you a heads up on what they're doing and how it will feel, so you're prepared for each step. If they don't, you can ask them to do this. It's important to take deep breaths during this part and to communicate to your doctor if you're feeling uncomfortable in any way. If you're over 21, then your doctor might also recommend a PAP test. You can learn more about PAP tests in the written article next to this video. Okay, well, it's Maddie, signing off. Goodbye.
Goodbye. Should I do a little peace sign? I don't know, I quite like how I look in this. Okay.
Goodbye.